Hi guys, Don here. Welcome to Podiatry Practice Mastery, where we're helping you get your individual production into the $2 million mark and beyond. So I'm going to go over, I have a lot of days. I've started to track again. So if you want my new treatment tracker, I've modified it a little bit to make it a little bit easier. The way it works now is I put the visit level, like the level 3 or level 4, the age of the patient, some area for notes, and then I have these little check boxes now. So I can check actually if they got orthotics, imaging, DME, procedure, follow-up. If you want that, you can go to Podiatry Practice Mastery. You can get the $1 million blueprint, and in there you'll find links to my Google Drive with all these, the daily treatment tracker is what I call it. So this is what I print out every day, and I kind of go through it and fill it out. And it kind of helps me kind of see, okay, I did procedure on these many patients, I did this many orthotics, this many DME, and things like that. So if you want to see that, happy to share that with you. Okay, let's go into the day here. I'm going to go through a number of days. So let's talk about shockwaves. So left plantar fasciitis, a 41-year-old female, number 1 out of 6. Next was a 75-year-old female, had right plantar fasciitis. She had a history of a femur and a tibia fracture, and now she's doing much better. I'm going to see her back in 3 weeks. She's going to do the Pelto special, which is a night splint, foam rolling, and morning stretch. And then we'll see her in 3 weeks to see how she is doing. Okay, and then if she's not doing better, the plan is always an ultrasound next. Next was a 62-year-old man with right posterior tibial tendonitis. He's been doing better with the velocity brace, but brace really isn't great all day. And that's why we transitioned him to an orthotic, because an orthotic is going to be a better thing. So there's orthotic number 1 of the day. He'll follow up after that. Next patient was a 64-year-old female. It was a pre-op for bunion surgery. So they tend to purchase a shower cover at that time. And I did prescribe her the EBM for the bone healing after this osteotomy. So this is the first time I've done that. I'm trying out EBM. And I actually set it up a proxy account with my scribe, so he can actually do these. He kind of does them, and then I still have to sign off on them, just so you know, because they're prescriptions. Next was a 31-year-old man, right plantar fasciitis. He got my Pelto special. Once again, night splint, foam rolling, morning stretch. See him back in 3 weeks. Next was a 55-year-old female, posterior tibial tendon dysfunction. Orthotic adjustment, like number 10. And and those were frustrating. So I tend to tell patients, like the first orthotic follow-up is in 6 weeks. If they need one before that, I have them say, please make a medical assistant appointment. Because I don't like to charge them, and I don't want to occupy a slot. So what I do is I say, do a medical assistant follow-up on a day that I'm there, and I'll take a quick look at them, because they're usually pretty quick. Next patient was a 47-year-old female, right fungus, did Sporanox, because she has tried terbinafine and diflucan, not much improvement, so I do Sporanox. 6-month follow-up, so they did 3 bottles of the Theranale. So the Theranale is the stuff to make it grow faster. So that was 3 bottles of that. Next was a 64-year-old, that was the morning, then the afternoon, 64-year-old female with some lateral heel pain, had equinus, and had kind of lateral insertional Achilles pain. So she did the Pelto special once again, and I'm going to see her back in 3 weeks. If it's not getting better, ultrasound and possible shockwave. Next was a 66-year-old female, bilateral hallux ingrown toenails. The plan was a partial nail avulsion on those ingrowns, and then the plan is a Onifix when she comes back in bilaterally to help the nails to kind of straighten out. And she also did Theranale for her nails. Okay. And this was, there must have been some thickening, or maybe I was doing terbinafine for her as well. Next patient was a 55-year-old female. Had, the problem is when you can't read your handwriting. I did a nail sample for her, and she's been using tea tree oil, I think, in Formula 7. It didn't work. She was being seen by another doctor. And I did a nail sample just to verify, and we talked about either a laser or avulsion of that nail. So I'm going to see her back for a nail sample in 3 weeks. Next was a 34-year-old for left plantar fasciitis. After 6 sessions of Shockwave, she's feeling much better. She's also tried dry needling and other types of things like that. I did EPAT today, no charge. So sometimes I do an EPAT with no charge, especially after I've done 6. So I'm doing an office visit. I've seen them multiple times. I still think Shockwave is beneficial, and so I'll see her in 3 months. Next was a 32-year-old for a male for a matrix bilat colat. Next was a 34-year-old for left Shockwave number 5 out of 6 for the lateral 5th med head, so like a bursitis or a capsulitis. That was one day. Then actually the next was a 71-year-old man for a right brace follow-up, and probably like an AFO, and then it did nails, and then the last one of the day was a 77-year-old female for right ankle pain. I made her, since this is an interesting one, 77-year-old female. She is now an Ozempic, lost a lot of weight, and now her AFO is pistoning up and down because there's so much extra space in there. So I casted her for a new AFO, got a new AFO. Now we have to kind of sell it to the insurance or like verify because of the weight loss that she qualifies for that. Okay, that was the end of that day. This is another day that we're talking about here. First was an 86-year-old female. She had a right 5th toe ulcer, did betadine, surgical shoe, so that's a DME item, and I debrided the ulcer, which is a procedure. Next was a 72-year-old female. She had a left AKA and an ulcer now on the left foot, so we debrided that, and we're going to see her back as needed. Her real issue, though, is I think she's a vasculopath, and she will need a vascular referral so she doesn't lose that other left foot. Next patient, a 35-year-old female with a wart. I did cantharidin on there. Next was a 71-year-old female for left 2nd metatarsalgia. She wants to try NSAIDs and see if that works. If not, her plan will be ultrasound and possible Shockwave in 4 weeks. Next was a 42-year-old female, fungus. She's here for a second opinion. She has it on the left 2nd toe. She did lunula number 1 out of 4, and then I recommended my kit, which is the UV light, the shoe spray, and the biotin. That's what I'm doing for that. Next couple were Shockwaves. 31-year-old female for number 2 out of 3 for bilateral Achilles. The reason it's not 6 is because she's had it before with 3, and she wanted to stick with what she used before. Next was a 43-year-old female for number 5 out of 6 of Shockwave for the posterior tibial tendon, feeling better. She's waiting for her orthotics to come in. Next was a 53-year-old female, status number 5, post-op number 5 for one of my colleagues that did a lapidus, and then I did an x-ray on that, just reassured the patient. Next was a 60-year-old female, left Achilles number 5 out of 6. I plan to scan her next visit for the orthotics. Next was an 81-year-old female, left medial hallux IND. Next was a 24-year-old female for a matrix bilaterally as a follow-up. Those are quick follow-ups. And then a 57-year-old person with sciatica. We scanned her for her orthotics due to her pronation. Okay, so this is this day. A couple of things that we're doing. Something that I kind of feel embarrassed to say is that our virtual assistants, or actually on our website, we don't have an admin email. We have doctor emails, but there's no admin email. So what I'm going to do, and the part of the problem to that is a lot of our email downloads, for example, ebooks, making our appointments via the form that's online, all of that used to go to me, and so we started to make an admin email for our office so that all the emails can go to that whoever that admin person. It might be a virtual assistant, it might be someone else, but I'm kind of excited. So what the plan is now that they're going to get all these like book downloads, and we changed all of our downloads to ask for more information. So it asks their name, their email, and their phone number. And so when that comes through, it'll automatically send that to the admin email, and they're going to start a tracking sheet. So they're going to call and follow up with those patients, make sure they got it, see if they wanted any help, if they wanted to make an appointment. So I think it's going to make it a lot easier for emails. We just didn't have an email account that anyone was monitoring, but now I feel like we have someone that can monitor that. Okay. Let's go to the next day here. This is a 73-year-old for left ball of foot sesamoid pain. Put them in a cam boot. Did the EBM anti-inflammatory, and I'm going to see them back for an ultrasound in 2 weeks if it's not better, and possible Shockwave. So I found that this new EBM turmeric pill, or this, they call it a medical grade food, patients are liking it, especially if they're doing Shockwave or if they're on Coumadin, because they usually can't do anti-inflammatory. So a lot of patients are amiable to that. Next was a 21-year-old for bilateral warts. They're getting better, almost gone. So when they're almost gone, then I put salicylic acid. So I put a lighter acid on there, and they're going to follow up as needed. Next was a 16-year-old man number 6 out of 6 for lateral ankle sprain. This one had a really bad lateral ankle sprain playing basketball. Like the thing was blown up like no one's business. And I find that doing Shockwave, it just really got him back much, much faster than I've ever seen an ankle sprain before. So I think for areas that are really swollen, they need to get back quicker. And I did that every 3 days for him. So I did those 6 in a short period of time because he wanted to get back playing. Next was a 62-year-old female for a left hallux partial nail avulsion. I did a nail sample, and we talked to her about possibly doing laser in the future. Next was a 69-year-old man for a left 4th and 5th digit flexor tenotomy. This was my MVP, most valuable patient of the day, because of those flexor tenotomies. I think now I've done like 2, 3, 4, and 5. I probably should have done them all at once, but I don't normally do that many. But that's an easy procedure to do in the office, and I wrap it with Coban, and I have them seen back in 3 weeks. Next was a right Achilles patient, and I did an orthotic, so I scanned this patient for orthotics, and I'm going to see them back in a few weeks for an ultrasound and possible shockwave. Next was a patient with right sinus tarsi pain. I did a cortisone injection. Next one was a 70-year-old female for a right hallux nail avulsion. Next was a 72-year-old for right plantar fasciitis. Sent her out for PT. Seeing them back after PT. So patients don't want to do shockwave. A lot of times they'll say, hey, you can go to PT for 6 weeks, and then I'll see you back. So I usually do, since they do 6 weeks of PT, then it takes a couple weeks to get in, so I usually do an 8-week follow-up for them. Next was a 64-year-old for left plantar fasciitis after orthotics, and they did not want to do these other treatments, so I did cortisone. This is cortisone number 2. And then for cortisone patients, I tend to push them out. So things that I want to see, I'll see them more frequently. Things that kind of aren't doing like what I recommend, or the things that I want, I'm going to push them out. So I'm going to see them back in 3 months. Next is a left ingrown. I did an IND. Next was an 80-year-old female for an orthotic follow-up. She's feeling much better, and she's going to come back as needed for her callus if it hurts her. Next was a 69-year-old for nail sample follow-up, and they did Lamisil in my fungal kit. And then next was a 29-year-old female. I did diflucan and for this patient. That was the morning. Afternoon was an 80-year-old male for right plantar fasciitis number 6 out of 6. This is the last one. Remembering, whenever I do the last one, I give them the last shockwave treatment sheet, and I tell them this will be an office visit, because otherwise I get a lot of kickback from patients saying, why did you do an office visit? I said, this is called evaluation and management. Next is a 73-year-old man for right cellulitis. He got doxycycline from the urgent care. I did a CBC, WBC, kind of gave him some shoe things, recommendations, because he has a cavus foot, and I'm going to see him back in a 10-minute slot in 2 weeks. The next was a right heel pain. This was a routine patient for one of my colleagues. He also had midfoot arthritis, specifically to the 1st, 2nd, and 3rd tarsal metatarsal joints. And so I did injections to all those joints, and then I did an orthotic. So that was orthotic number 2 of the day. Next was a patient, 90-year-old female, that was a rubbing on a right bunion. And for this one, I did a bunion, just recommended shoe recommendations for her. She had no circulation. That was kind of the issue, I think. So that's another issue. Next was a 9-year-old, had a wart. He had it removed, and it's looking better. And so I'm going to see back as needed, follow up. So this is when I removed, and it was seeing them 3 weeks later. It was looking better, but I was a little concerned about recurrence. That's why I'm going to see them back. Next was a 16-year-old man for an ingrown bilateral IND, and had also flat feet. So I did one of the prefab inserts. So I'm starting to do more prefabs in the office. We're using the Northwest ones. And next was a right hallux fungus. They did Cutera, Theranale. They got 3 bottles, and then I don't think I gave them diflucan at the same time, but they may have tried Cutera in the past. Oh yeah, now I remember. This one, I'm starting to try like Remy, and we have a Cutera laser. Just like one time, I'm just doing it, and then I'm putting them on some oral. So really just to debride it down, doing some laser, and then seeing how they do with the other orals. I've been trying different things. I'm trying to really improve my confidence in laser, because I think that could really bring my production up, and I think it would help patients, because so many come in asking for laser, and I'm usually talking them out of it. So I would like to learn and be confident that it would give them good results. Next was a right hallux matrixectomy. They got the kit afterwards, the post-op kit. Next was a 62-year-old they had physical plantar fasciitis. They wanted here a second opinion. And this was really one of my MVPs. They got x-rays, ultrasound, and I recommended the Shockwave, the amnio injection, and the orthotics. So this was so all that together is about $3,600, and they said no. And so I'm learning how to get no's from patients, and so I probably needed to talk to someone about that. But this was one that I'm trying to offer these bigger kind of combinations of treatments. Next was a 66-year-old man for a nail sample follow-up and also second med head pain. He got a prescription for the medication and the fungal kit, and he got shoe recommendations. And then next was a 57-year-old man whose foot wasn't better, a second med head, and we ordered an MRI for him. So that was that day. We're getting down to today here, okay? Let's go. Next patient here is a 74-year-old with a 5th med head wart, did lesion destruction. Next was a 46-year-old for heel pain. I did phase 1, so if you look at my heel pain sheet now, it says phase 1 and phase 2. So phase 1 is x-rays, prefab, and the Pelto special, and then the meloxicam. I'm going to see him back in 3 weeks for a possible ultrasound. Next was a 32-year-old man for a right hallux IND. Next was a 48-year-old female for a left stress fracture. So did x-rays, cam boot, compression sleeve, and I used the fracture code. So that's a pretty good one when you do those fracture codes. See them back in 4 weeks with x-rays. Next was a 74-year-old female for bilateral partial nail avulsion. I debrided the nail. So whenever I can debride a nail, I'll do nail avulsions and debriding. So debriding tends to pay regardless if they have class findings because of the toe pain. Next, a 49-year-old with number 5 out of 6 for peroneal tendon pain. And then next was a 75-year-old female for number 2 out of 6 for 5th met base pain. So she had like a bursitis at the 5th met base insertion of the peroneus brevis. Next was a 24-year-old female bilateral ingrown for an IND. And next was a 61-year-old female for an ulcer that was healed. Recommended physical therapy for balance because she was concerned for her neuropathy with balance. There's a special place around here that does balance PT. Next was a right third toe suture removal. This is the patient that was post-op. I'm concerned, this is the in-office amputation. I'm starting to do amputations in the office just to save me from going to the hospital. But this like dehisced, and so I was doing Shockwave and then wound care for this one. So it dehisced a little bit. Had to put a couple more sutures, took them out. It's looking better. Next was a 20-year-old female for left neuritis. It's feeling better after the gabapentin. So I'm going to have her titrate down and then follow up as needed. This is a 55-year-old. This is the same one that I talked about earlier that was here for her arch again with her orthotics. So like number 3, occupying my time. So it was my least valuable patient. It was a free patient because I didn't bill an office visit. So these ones I'm trying to get the medical assistants to see and just me see them when they're there to not take up a slot in my schedule. Next was a bilateral bunion and hammer toe. We did x-rays and a metatarsal pad for this one, and they're going to come back as needed. Next was a 17-year-old who had a callus, and she is here after her number 6 out of 6 shockwave. So she did 6 shockwaves for her bursitis to her 5th digit because she was a ballet dancer and always on toe, and that caused a bursitis that was painful. And so that all calmed down after the shockwave, but she still has these calluses. So I said, you'll probably need to come in every 3 to 6 months for that. And then next was a 63-year-old female for right plantar fasciitis, number 2 out of 6. And this one was an amnio. So this one I did an amnio, second visit, and the plan was going to be orthotics next visit. So that would be another MVP for the amnio for that patient. The final one here in this list that we're doing. Oh boy, I'm going to stop this one, guys, because it's getting too long and I'm getting tired. But I hope you guys find this beneficial. I'm kind of saying the things that I'm working on. A couple of other things I've been trying to do is something called a rolling commentary. So I learned about this from I think he's an Australian podiatrist, Ted, and he talks about this rolling commentary. And I like this idea. And I think what all that really means is that as you're talking to patients, you're commenting on what you're doing. So like currently, it's really going to help my scribe as well because he can't see anything. He's just listening. And so I do a rolling commentary about what's going on, and really you're just saying, okay, what you have is this, at the midfoot you have this little bone spur. It's called a exostosis. It might hit on the nerve. It might rub in your shoe, but that's what I'm feeling right here. Okay, but if it doesn't hurt, you don't have to do anything. And then you kind of do that for everything. You have a little bunion here. So a lot of things that we see and we don't tell patients about, and they're questioning. Like, so when I'm doing ultrasounds now or x-rays, I'll look at it and say, okay, this is this. You have the IM angle, which is the bunion angle, is this size. It just shows that. You have metatarsus adductus, which just means that the bones are kind of shifted in a little bit. So I'm kind of explaining as I'm going through it, not for me to look more intelligent, but I'm doing it mostly just to put the patients at ease so they understand what I'm talking about, and I try to talk about in simple terms. So this is a comment which I never heard about before called a running commentary, because I think a lot of times we just listen and then we examine and then we tell, and we don't tell them everything, and a lot of times they're wondering, well, what's he seeing on that ultrasound, or what's he feeling that for, or why is he doing that? So being much more open, I think, is going to help me. So I'm going to push. Okay, what I'm doing now is I'm pushing on the bottom of your heel, right here where usually people have plantar fasciitis. So if I push here and it hurts, that means you have plantar fasciitis. Or things like that. I'm evaluating now the position of your heel to see if there's laxity in your heel. If your heel goes out, when your foot goes out, that's a sign that you have a flatter foot and you have more of an unstable foot in the midfoot region. And so these are things that we can talk about called a running commentary. So I would recommend you kind of think about doing that. That's been something that's been a neat thing to change in my practice. Okay. Once again, if you guys found this beneficial, let me know, and please go to podiatrypracticemastery.com to get all of my other free resources there.